If you need immediate help, please call the National Substance Abuse and Mental Health Hotline at 1-800-662-HELP.
Bottle of wine, fruit of the vine. When you gonna let me get sober? Let me go home and start over.
Welcome to Clean and Sober Radio, brought to you in part by Jefferson University Hospitals and Thomas Jefferson University, providing excellent clinical and compassionate care in the Philadelphia region, a proven leader in healthcare and education since 1825. And now, here are your hosts, Gary Hendler and Mark Sigmund.
Hey, hi, everybody, and welcome to Clean and Sober Radio out of Philadelphia, Pennsylvania. Clean and Sober, we discuss issues about addiction to drugs and alcohol. And, Mark, it feels like we haven't been here for a while, man.
We were just talking about that. We were trying to remember when the last time we did the show was together, and we couldn't remember.
Well, I forgot to bring my cheat sheet, which gives me the whole schedule of the show.
Great. We're going to be rusty today, I
That's what
think.
you said
It's
before
going to
we
be
went
a
on.
little bit rusty, but I think we'll make it through, Gary.
All right, I think we will, too. Hey, what's new today in the recovery news?
So it's, I read a crazy article this week, and it was out of the New York Times. And the New York Times reviewed 20 of the largest marijuana brands found that were the most selling products at dispensaries. And what they found is that these brands are touting things like being able to help with bacterial infections, even preventing cancer. They're also finding that they are actually dusting the joints with high-potency THC, and they're touting some of these brands as 99% pure THC.
And a couple other ailments they say this will help.
Yeah.
Depression, PTSD, gastrointestinal disorder, ADHD, migraines, Crohn's disease, and asthma.
Now, a couple of them I agree with. Crohn's disease, can be very helpful with. They've also seen some help with asthma, but what really gets on my nerves is there's no studies backing a lot of the diseases that they say it treats.
Right, and that article, I should have been listening when you read it.
Yeah.
It has to do basically with the potency is way out there,
Way
and
out
the cost is way low.
Yes.
So it'll be accessible to a lot more people.
Yes, and there's the oversight isn't there because what you're also hearing about is toxins in the marijuana and some of the testing not being on point with pesticides and things like that. And really, it's the Wild West of dispensaries at this point. Now, I have a feeling over time some of this will get cleaned up, but we'll see. But it's dangerous with the kids and stuff getting into it.
Do you think a central organization should take this over, federal government?
I do. I do. In other words, more oversight with things like the pesticides, because there are certain rules out there that they're supposed to follow, and they're not always being tested the way they should. And because that's what really scares me is, you hear of these pesticides which can lead to cancer eventually and things like that. But I think there should be some oversight. I've never been a huge fan of tons of oversight of everything,
Right,
but
of course.
but definitely more than's going on right now.
Well, we have said this from 10 years already. This is going to be it's going to be a big, big problem.
It's a big experiment, like in Pennsylvania when they put, marijuana as a treatment for opioid dependency, and there was no studies backing this. Yeah. And I would have clients come in and bring this up, and I would be like, we see they start smoking pot, then they go back eventually to their drug of choice. So not everybody, right? Yeah. I mean, we'd much rather them just be potheads, but, most of them.
All right, let's do this. Let's take our first break. When we come back, I want to talk about, all the things that are going on in this country and how this does affect the uncertainty, affects addiction and the recovery community. And we'll be right back.
This is Clean and Sober Radio.
A cancer diagnosis can knock the wind out of you. The Sidney Kimmel Cancer Center at Abington Jefferson Health can help. Our brand new Asplund Cancer Pavilion brings you 86,000 square feet of cancer-fighting science for truly comprehensive care. Backed by the strength of an NCI-designated cancer center. Call 1-800-JEFF now. The Sidney Kimmel Cancer Center at Abington Jefferson Health. The power to out-science cancer.
Hey, everybody, this is Tommy James, and you're listening to Clean and Sober Radio, and so am I.
888-728-9941. This is Clean and Sober Radio.
Hey, and also, you can also enjoy this show whenever you'd like. Besides right now, WWDB in Philadelphia, we're also simulcast with WPEN 97.5 FM in Philadelphia, and also Tampa, Florida's WJBR AM 1010, Saturday mornings at 10 a.m., and Augusta, Georgia radio station WGAC AM 580, Sunday morning at 11 p.m. is at night, isn't it?
It sure is.
At night. Okay.
People moving in white because of the color of the skin.
That's such a great song, especially what's going on this weather. Temptations. I think that record came out in '68. The comforting thing is there's been turmoil in this country at different times, not just now, but all, in the late 60s with all the stuff that was going on. And very apropos for what we want to talk about today, right? But before we talk about, I want to know where the hell you've been.
Oh, and I want to know where you've been. Because when I'm going to be on the show, you're not on the show. And I had alumni hockey weekend a couple weeks ago, which was really cool. Went up, got killed by some 23-year-old college hockey players.
Did you?
Oh, yeah. I mean, they're so fast, and you go out there and you're like, wait, I'm almost 50 years old, I wasn't fast back in the day, and these kids these days, they're starting like so young. They're just so fast out there, and so that was a lot of fun. Went up to Poughkeepsie, New York, and
is Poughkeepsie where you had that legal problem years ago?
Yeah, it was actually in Highland, New York, which is across the Mid-Hudson Bridge. It was on 299, and it was the New York State Police, which, by the way, I've just had somebody request that record almost 30 years ago.
They'll have to go into archives to find that, if they can find it.
The state police have destroyed it. That's what I found. Yes.
Yeah.
Yes. So it's a whole thing, but that's a whole nother topic.
That was a major crime.
Oh, it was a major crime. I actually went to the police station and got my fingerprints taken, Gary. Unlike, some of what you faced, right?
Yeah, right.
Yeah.
So, all right, where else you've been?
I've just been hanging out because the other shows were your fault.
Yeah.
They were your fault.
You're
so
right.
I've just been,
You're right. You're right.
So how about you? Where have you been?
Well, let's see. 2 weeks ago, we had the folks from Philadelphia and all the things that they're doing with Kensington and doing a really great job with the wellness center and everything. And then last week, I couldn't stop coughing, so we put on a rerun with Ricky Byrd.
And that's it. That's a great show. I remember. It's just all Ricky Byrd shows.
And he doesn't even know it was on.
He doesn't even know.
But I can tell you something. Next week, here's a preview. Mark Stein from Vanilla Fudge is going to be on next week, and that he's always a good. He's a great. What do you call him?
Keyboard player.
Keyboard player.
Yep.
That's it. Keyboard. Well, it's good we're all back. Brad's here. We're here. Eric's here. Tyler's here.
Live, and we have all our people on Facebook and listeners, and it's good stuff.
It is good stuff. And let's again, guys, if you're listening and you want to watch us, go on Facebook, Clean and Sober Radio page, and when you make your comments, let us know where you're living, where you are right now.
Yeah, and we're trying to keep track too and find out. We've got people listening from all over the world at this point, which is pretty cool through the internet.
It is cool.
So.
And what were you saying about our podcast, Mark?
Our podcast is in the top 10th percentile in the world of downloads, which is pretty darn cool, right? I mean, it's. I was looking up the numbers, and it's funny because recovery podcasts have always done really well. And I think there's a lot of people that just like to fall asleep at night and listen to them.
Yeah.
So.
Listen, I remember when I was a kid, I would listen to WWDB FM. It was talk radio.
Yeah.
And it was very soothing.
Yeah.
Even as a little kid listening to this crap,
It almost made you feel like not alone.
Right.
I used to listen to that too.
Did you really?
Bernie Herman, them. Yeah.
Irv Homer.
Yeah, it just made you feel not alone.
Yeah.
That's what I like about talk radio. And that's what I like about that this show runs live. You know?
Yeah, absolutely. And I think it's the best radio at being entertainment and informative.
Yes. Yes.
So let's talk about. I'm worried that a lot of people will not get into recovery, and those in recovery will relapse because of all the craziness that's going on around us.
Yeah, I was actually telling you earlier, I was at a coffee shop getting coffee, and I was talking to this lady. She was a little bit older, and she was asking me what I do for a living, and I said I was a therapist, and she's like, I need counseling. And so I was talking to her, and I was asking her about what, and she was saying she's been really stressed out with everything going on in the world. And that's not a new thing. As therapists, you run into that. And, we're not getting into politics here or anything like that. It's just more of people, they sit at home, they watch the news. Who knows if all the news is accurate, right? And they get stressed out. And some people that are very isolated with mental health issues are constantly watching the news.
Yeah, absolutely. I found, at least for myself, I watch very little news now.
Do you?
Yeah. I don't want to hear from any side. I just don't want to hear it.
I watch tons of news.
You should stop, Mark.
I should, but I actually watch all the channels because I figure the truth is somewhere in between.
Maybe. Right. Is that true?
I mean, in other words, to find the middle ground where there isn't bias, I watch everything.
But, it's true. Stress really can affect your sobriety.
It can. And when you're dealing with a lot of people in sobriety have anxiety issues, right? And tend to do what we call catastrophize. And if people don't know what catastrophize means, that means to blow things up even worse than they are without data to support it. And, in recovery, that can lead to relapse.
Absolutely.
It can lead to relapse. People getting up in their heads and they're thinking like the world is ending.
Right.
And
catastrophize it. And here's my advice.
Yeah.
You don't have to watch the news all day long. You know what I mean? There's a lot of other stuff to watch that's uplifting.
There is. And the funny thing is that if you turn off the news, you won't even know anything's going on most of the time, right? I mean, I'm talking local news, world news.
Yeah.
I mean, unless you're in a certain neighborhood where there's a lot of violence and stuff, most of the time, like it's no different than it is on any other day.
Yeah. And, catastrophize, but, addiction, recovery, it can be affected by, different, it doesn't have to be political. I mean, the thing that happened last week in Philadelphia, the plane crash in Northeast Philadelphia in a residential neighborhood, that kind of stress, who knows who was watching that and just went off.
Yeah, and people with a history of trauma. I mean, to give you an idea, when that plane went down, that small plane, I'm probably live 25 minutes away.
Right.
People in my area felt and heard the boom.
Did they really?
Yes, I didn't because I had like kids running around the house and all this stuff, but they felt shaky and things.
I was supposed to get on an airplane. The plane that crashed in Washington over the Potomac, the next morning I was supposed to get on a plane.
Wow. Did you cancel?
I didn't go. Marjorie and Lizzie went. I didn't. Part of it is I don't like to fly, but I do.
I could predict that.
Yeah, right. I mean, the worst thing to me would be a plane that goes down in the water.
In the water.
And the sharks,
Yep.
So, I mean, it was just. And then I heard another plane went down last night. 8 or 10 people were killed.
Really?
Yeah. I can't remember. It was in the United States.
Oh my gosh.
Yeah. So, but this kind of stuff, this kind of news, doesn't have to be political. Just horrible news can really, if you're in, you talk about a lot. You isolate and you start listening and watching this stuff, your head can play a lot of bad tricks on you.
Yeah, and if nobody's around to kind of ground you, you can really run with it.
Yeah, absolutely.
And it's definitely one of those things that we see. And, the perfect example is the COVID pandemic. I mean, that was the ultimate trigger. That was the ultimate trigger.
Did you see numbers increase?
Well, no, because it was hard to figure out where everybody was at because a lot of the services were over telehealth. Right. And a lot of people actually, it was like the perfect environment for an addict. Right. It's like, work was closed down or moved to telehealth. I saw some people where their eyes were lighting up with like, this is my opportunity. And so, but after it went in a little while, you started seeing the numbers come up of people hitting bottoms and things. But everything, mental health wise, big time, and you saw increases in overdoses and all that stuff. But at first, it all moved to Zoom. I was working outpatient, and I didn't see a spike. I think people were just running. They were out running. Yeah.
Hey, for just joining us now, Mark and I are talking about, what's going on in the world, now, and, what has gone on in the world, and how these events, these negative events, affect our recovery community. And it's for real, man,
Yeah, and we would love to hear from you. Our number is 888-728-9941. That's 888-728-9941. And tell us how you get through just when things happen, the pandemic. And, again, especially for those newcomers out there that are just trying to get on board with sobriety and deal with stress and stay clean. We would love to hear from you.
Yes, we would, Mark.
We would.
And by the way, if there's a lot of ways to listen to us and to watch us. Obviously, you can listen to us on a radio, if you still know what a radio is. You can watch us, go to Facebook, go to our page, Clean and Sober Radio. And Mark, what other ways can they...
The podcast, the top 10th percentile in the world, right? Go to the iTunes store, Apple store, and even if you just put in Clean and Sober Radio, Clean and Sober Broadcasting, you'll be able to find it's carried on lots of different podcast sites. And it will be delivered to your inbox every week.
And by the way, if you go to our website, there's a PayPal button.
Yes.
Why don't you make a donation if you like the show? Okay?
Yes, and that's cleanandsoberbroadcasting.com.
Bill G. from Atlanta, Georgia writes to us, read your pre-show post on Facebook last night, and I agree with you regarding all of the drama in the world would probably increase relapse and hold back someone who might be looking to get treatment.
Yeah, I mean, it's hard to say, how much it's just going to hold people back from getting the treatment. We might see an increase in the treatment.
Could it push people to get treatment?
It could.
Yeah.
Again, we're not in the pandemic where everything kind of shuts down. But I think where you really, really see it too is on the mental health side. I mean, you see it with people that are depressed, and then they sense this chaos going on, and they get more isolated. And like we said, they're watching TV all day, and that's, you see that a lot. And we've seen it again after the pandemic kind of panned out. It was like nobody had enough clinicians to see all the people that wanted individual therapy. Sure. I mean, and they still don't. There's waiting lists, and the mental health went through the roof.
And waiting doesn't help.
No. No.
I mean, did you ever have a panic attack? Did you ever have patients that had panic attacks?
I've had. Me too.
And that's not just, people think that's like, oh, you feel nervous. No. You go to a different place.
Yes. You feel like you're gonna die.
Yeah.
I mean,
or blast off.
I mean, I remember, I don't know if you want to hear a quick story about one of these. So it was the 90s, late 90s, and I was home alone, and I was smoking pot out my window.
Yeah.
And I was home alone, and I had a really bad cough before that. And all of a sudden, I'm like, I can't breathe, And I'm like, I can't breathe. And I went and I got in my car and I drove to the ER. And I don't know if anybody's ever had tunnel vision. That's like where everybody looks small out in front of you. And I went
There's no peripheral.
It's tunnel vision. And I was like, I'm having a heart attack, And so they took me back right away. And some lady came in and was like, the nurse, the doctor came in for 3 seconds. He wasn't even in there long. And some lady came in with an Ativan, and I knew about panic attacks. And I was like, you think I'm having a panic attack? No, this is a heart attack. And that's the thing is when you're going through it, people could tell you that you're not having a physical problem and you do not believe it,
One of the first times I ever had one, I was driving past a methadone clinic in West Philadelphia.
Yeah.
And I saw people standing outside, and all of a sudden I got that feeling I had to turn the car around and get home.
Oh, no.
It was so, and it's like, how does this happen? Why did this? How does that trigger? But it was a methadone clinic. I was driving by. I was like, oh man.
Do you want to know how they start? One of the big ways they start.
How?
So basically, we're trained to kind of breathe deeply when we're stressed out, right? And so somebody breathes so deep and they keep breathing and they offset the carbon dioxide and oxygen mixture in our blood. And so really what that does is it makes you feel like you can't breathe.
Is that right?
Yes. So you literally feel like you can't catch your breath, right? And so and then that creates, even more panic. Don't get me wrong, there's extreme anxiety that's going along with this, but the hyperventilating really feeds into it. And so I actually tell people, like, breathing into a paper bag or just breathing through your nose, you'll feel like you can't breathe, but it should eventually reset that.
That is very interesting.
Yeah.
I never knew that.
Yeah, it's hyperventilation. It really, kicks in when somebody's having a really bad one, and I've seen people have the most severe panic attacks you could ever imagine. I mean, they couldn't even talk. I mean, they were,
Listen, I remember the first one I had, I was down the shore.
Yeah.
And I remember thinking this, I will give every single thing I have away to stop this.
Wow. Yeah.
And then you get afraid, when's it going to happen again? I mean, luckily, I'm knock on wood, I haven't had a panic attack in years, but
Me too.
I'm knocking on wood.
Dude, if you have a panic attack on the show one day, I shouldn't even laugh about it.
How do you know I'm not having one right now?
Gary just takes off, right? Where did Gary go?
He left.
No, but it is scary. I mean, it is scary. and if you have a panic attack or a couple of them, you're more likely to have them.
Great.
So it is scary, how you can increase the amount.
Did you hear that?
I did. I did.
Good.
Three Stooges.
Okay, look. Hey, again, if you want to watch us do the show, because I'm having a good laugh today, Clean and Sober radio page on Facebook, just like these great folks. Kathy Wolf Collin, and she is in Coral Springs, Florida.
There we go.
Thank you, Kathy. Eddie Kilgore. Eddie K is watching. My cough. Judge Christopher.
Nice.
Judge Christopher Maddox is watching. We had a great dinner last night, man. We really did. Allison Price Berwick. And Judge Maddox says he's in Drexel Hill, Pennsylvania, which is at Delaware County outside of Philly. Michael Thomason.
My good friend.
Debbie Reynolds. Mark Willig. Hi from Doylestown, Pennsylvania. He says, a rough day at dialysis. Have a great weekend. Love to all. Don't pick up and you won't use. Good.
Man, I hope you feel better, Mark.
Yeah. Counselor Michael Forbes is
Hello,
watching.
Mike.
Yeah. Debbie Reynolds. Hi from Central Coast, California.
Ooh.
Where's that? Central Coast.
Central Coast. I guess that's below San Francisco, or maybe that is San Francisco area. Maybe she can let us know.
I guess so. Allison Price Berwick says, love that song that we played by the Temps. Thank you for the education and empathy. A great show. Well, thank you so much. It means a lot to all of us here. And you're in New Hope, Pennsylvania. She says, fly, Eagles, fly. What does that mean?
The Eagles.
Oh, yeah, the Eagles.
Yes.
Sunday. Best of luck to the Eagles, everybody. Mike Burke, Media, Pennsylvania. Go Birds.
5-year listener, by the way.
Is he?
Yes, he's got the badge. Yep.
Allison Price Burke, the news is cancerous.
Yeah.
Yes, it is. James Bilderback, who's my neighbor down the shore. What a great guy. In fact, he's on the same floor that I am in Ventnor. Yeah, he's a good guy. He says, great show. Go Eagles. Jim Petrowski's what? Who is Jim Petrowski?
Jim is the absolute man. Jim is a huge part of the
yes,
starting
he is.
Starting the show, right?
Yeah,
Getting it going.
Yeah,
guests, finding guests.
He's one of a kind. Great. He's a great guy. Larry Mayer. I think we got to cut it. I think we have to go to a break right now. Is that right, Eric? We'll be right back.
This is Clean and Sober Radio.
A cancer diagnosis can knock the wind out of you. The Sidney Kimmel Cancer Center at Abington Jefferson Health can help. Our brand new Asplund Cancer Pavilion brings you 86,000 square feet of cancer-fighting science for truly comprehensive care. Backed by the strength of an NCI-designated cancer center. Call 1-800-JEFF now. The Sidney Kimmel Cancer Center at Abington Jefferson Health. The power to out-science cancer.
Hi, I'm Billy J. Kramer, and I listen to Clean and Sober Radio.
888-728-9941. This is Clean and Sober Radio.
Hey, we're back, Clean and Sober Radio, and we're having a very civil conversation about how life can affect your addiction and how it can affect your recovery, and it's a real thing.
It is. I mean, I'll give you an example for an alcoholic. Is my mic turned down? It feels like it is, but I give you an example for an alcoholic. Once their stress response hits a certain level, it can easily bring on cravings. There's something about cravings and the level of stress in the body, right?
Yeah.
And so a lot of times in treatment, we're working on how do you get in a relaxed or calmer body. And when you're taking in a lot of this stress, anxiety, all that stuff, it can really lead to the old way of dealing with it was drinking, right?
And also, the folks in OA, food is a real powerful enemy when you're stressed out.
Yeah, and these are all attempts of what we call basically there's another word for it. It's basically trying to take care of yourself in a unhealthy way.
Yeah.
Self-care, but it's not really self-care.
Yeah. I know. It's God, we have so many things we have to be aware of in life that can harm us.
Yeah, we do. I mean, when those plane crashes happened last week, it really affected me because it felt almost like the world was falling down. When you saw, I saw it in Washington, and then when it happened 20 minutes away, it really was kind of scary,
And my fear, besides the shark issue,
Yeah.
is what goes on in an airplane when it's going down. The screaming. I get there are people screaming. There are people praying. There are people not doing anything. And, it takes a while for a jetliner, if they're really up there to get down. It's just, and we're sitting at home watching this. Watching it.
I had an experience with an airplane.
Tell me.
Well, I was taking a puddle hopper basically from Puerto Rico to Tortola, and we hit a storm. And I mean, it was turbulence like you would never believe, and turbulence and lightning out there. And the pilot took us down, and he had to abort the landing. And he said, "Sorry, guys, we had to abort the landing, and I have to take it around again. I'm going to get you down as safe as possible." And that's not what you want. This must have been a rookie pilot, because that's not what you want to say
safe as possible
on an airplane. And I was with my dad, and we start hitting this turbulence, and people are, there's screams.
There were screaming.
There were screams. There's people praying.
Yeah.
And I heard the one guy say, "God is our pilot," And my dad looks over at me and he said, "Mark, I heard we have a good pilot." My dad didn't know. He said, "God is our pilot," And I'm thinking to myself, he said, "God is our pilot." Like, it's not, And my one thought was, I'm like, if we go down on this plane, at least I'm going down with my dad, And thankfully, we ended up touching down safely, and it was a real weird feeling when you got on the ground. And you know how, in those areas, it turns from, stormy to, a sunny, perfect day?
Yes.
That's exactly what happened, And but it was really, really scary.
Well, I used to love to fly.
Yeah.
When I had about 5 Quaaludes in me. You know what I mean?
I can imagine.
After I got clean,
yeah,
the fear of flying set in on me.
Go figure. You ever see in The Wolf of Wall Street when they're out on the boat that's sinking and they're like, "Get the Quaaludes," right?
Oh, yeah.
I mean, go figure. So you probably had to, and that's a good example of how we tried to self-medicate things, right?
Yeah.
It's a good example. It's like, here's this sometimes phobias and this anxiety. And as a counselor, I see it all the time where, somebody gets clean, and there's a lot of baggage of anxiety and phobias and fears and all this stuff that we were trying to put a blanket over, right?
Yeah. I had an experience, I know this is off the subject, but whatever. I had a dental thing and a root canal, and the dentist said to me, "It's a shame you can't do anything to make yourself feel better like most people that come in here," because he knows my history.
Yeah.
It's true. We usually have to face everything on face value, man, right in your face.
Yes, which brings up a whole nother topic. Did you hear about the new pain medicine that was approved this week? For the first time in, I forget how many years, it might have been 15 or 20, they approved a new pain medicine that's supposed to be non-addictive.
For what?
For pain. For long, it's not for chronic pain at this point. I forget the name. Maybe somebody can look it up here off the top of my head, but it's supposed to be a non-addictive that works in a totally different way than opiates do.
So that's something you should look up, everybody, and go buy the stock.
I was thinking that this week.
Right?
I was thinking that, yes. But who knows? The problem with that is, like, is this really going to be effective, and are they going to really start using this instead of the opiates? You know, because the opiates they do their trick with pain. You know, I mean, that's the thing, is they do their trick with pain, you know. So is this really effective, you know?
You said it's been approved by the FDA?
It's been approved, yeah.
Well, it must be effective to some point, right?
Yeah, I mean, some of the numbers that I was looking at, it's not supposed to be as effective.
Okay.
But I forget the name of it off the top of my head, but maybe somebody could look it up as we sit here. But it's a brand new pain medicine that was just recently approved this week by the FDA.
All right, good.
So, yeah, that's what we need, right? We need other options.
Non-addictive.
Non-addictive,
Well,
yeah.
you know, they used to say that tramadol was non-addictive, but it is addictive.
Well, that's the problem.
Right?
I would get people, before they came out saying it was addictive, I would get people hooked on tramadol. And I would be like, we knew as addictions counselors that this stuff was addictive before there was this whole thing that this stuff's really addictive. They used to say that it was very light, like in terms of addiction qualities. Like it was, you know, and it turned out that it's very addictive. But, you know, I've known a lot of people that have taken tramadol instead of the opiates, and it worked for them.
Mark, it's usually a step down surgery. You know, the tramadol is like a step down from the whatever they're giving you. You know, Oxy or Tylenol with codeine or whatever.
Yeah.
Look, that's the pharmaceutical companies telling everybody it's not addictive to sell more.
And yes, so you got to watch. We got to take a close look at this, you know, and see are they really being accurate, right?
Absolutely. Here's an interesting question. Frank L. from Pittsburgh. Are there any facilities or treatment centers around to treat minors? Inpatient.
There are. They're very hard to find, right? To find good ones.
Yeah,
I don't work with you know, minors and you know, but we have run into issues with younger people. You know,
so where do these people go?
There's some facilities out there that, you know, a lot of them are Medicaid and things like that. And then there's some private ones that you can find. But it's definitely not the same as just going out for an adult, you know, and finding a place.
I thought that was an interesting question.
Yeah.
For minors.
Yeah, and you know, you could, if it's a drug and alcohol issue, you could call the hotline, you know, the substance abuse and mental health hotline, see if they can help you. And that's 800-662-HELP.
Yeah.
800-662-HELP.
Absolutely.
We're a mental health issue.
Yeah.
Yeah.
And if you want to talk to us, call us at 1-888-728-9941. 1-888-728-9941.
Oh, and we got the name of this medication. FDA approves novel non-opioid treatment for moderate to severe pain.
Yeah.
It's called Journavx. Journavx, 50 milligram tablets. It's the first in-class non-opioid I think it's pronouncing this, to treat moderate to severe to acute pain in adults.
Who's the company? Who makes that?
So this is made by, let me look at this. I have to read down here further. It doesn't say the company here over the top.
Oh, okay.
Yeah. Yeah, we'd have to read in here. I'm not sure the name of the company right now.
Okay. What's the name of it again?
Journavx.
Journavx.
Yes, which I'm probably pronouncing it wrong, but it's Journavx. And again, it's the first time in, I believe it's 20 years or something, that something's been approved.
Wait, who came up with that? Jim Bilderback.
We came up with what?
One of my buddy in Orlando, Jim Bilderback.
Oh, there we go.
New pain medicine is called Journavx. Oh, I thought, Brad, you did. Both of you?
Both of you guys did, but
Now, Jim Bilderbeck is a
Thank
banker.
you, Jim.
He's a banker. Now, how would he know this?
well,
He's a smart guy.
that's what
how-
we love about having
Yeah.
our buddies and our friends on Facebook here. You know, they always do. When we ask, they always do checks for us, fact
They do.
checks.
We're lucky.
We are very lucky.
Jim Bilderbeck,
Yeah.
and Steve Sussman.
Steve Sussman, he's like an encyclopedia down there in
Yeah,
Florida.
he is. Yeah, he is. He's a smart guy, man. So is Jim. Johnny Irish is watching. Does that mean this person is Irish? Do you have to be Irish to have a last name Irish?
I would think that you're most likely Irish, Gary. I would think so. You know, yeah. Edmund Anthony. I know he's had some pain issues and stuff. You know, again, it's Jernavix, this new medication. So,
Wow.
You know, also Allison Price Burnick says that she's seeing more teens in the school health office with panic symptoms, and the paper bag works.
Yeah.
So
There you go. Robin Davis is watching. I just want to acknowledge some of these people. I mean, Ed Mary Donnelly? Is the bridge still open for kids used to be in Northeast Philly, Fox Chase area? The bridge in Philadelphia, I thought that was a high school.
no, there's a treatment center, and again, I don't know. Maybe somebody could check that out for us. I've heard of it, the bridge, but I'm not sure.
And John Lennon's sister, Kathy Lennon, is watching.
Oh,
Pretty cool, right?
Seriously?
No.
Oh gosh.
Serious?
And we have another fact check here. James Bilderback
It's Jim Bilderback.
Yeah, says pharmacy company is called Vertex Pharmaceutical.
Jim, you and I are going to buy a bunch of that stock, all right?
This week I was teetering on
I'm going to
it.
look
Are
it
you?
up. Yeah.
Can you buy me some?
Sure.
I mean, that would be great. You know,
You should try it first, though.
I don't know. I'd have to have an
surgery?
actual injury. Actually, I had a rib injury from hockey. I should have asked them.
Recently?
Yeah, I went to the urgent care yesterday, and you could tell when they're asking. And I don't think they can do narcotics at urgent cares, you know. But I didn't want anything to do with any pain medicine, but because
They can write a prescription. I call it in. Nobody writes in. I think they can call it in.
they can. I thought that urgent cares cannot do narcotics anymore, but that could be another fact check on our message board.
That's exactly right.
You know?
To get back to what we were talking about earlier, what are some of the things that we can suggest to our listeners and viewers if you feel stressed out because of what's going on? Whether it's on the TV, the radio, or what's going on in your house, whatever. Some good tips on keeping your sanity. Number one, don't isolate, right? That's your big
It's
deal.
going to be the first one.
Yeah.
The first biggest one, and you see this across the board, is isolation. And some people have a lack of trust and a hard time letting people see their vulnerability. But people need people, and we're group animals. So when, having other people will help bring you down. Right, it'll help you bring you back to reality if you're running away with this stress and anxiety. Then all the other ones are the ones you always hear about, and that's like the self-care. It's like the going to the gym, the mindfulness meditation that you hear about, learning to calm your body with breath work. Which again, if you're really stressed and you said, well, I'm just going to try to calm my body down, it's probably not going to work very well. You have to really practice it every day, even if it's for 10 minutes a day, the meditation, and all the things that you hear about, exercise and self-care and diet and all those things can be really helpful. And again, also, seeing a therapist, there's a lot of online availability these days.
You go to meetings.
The biggest thing for us, drug and alcohol, right?
Just don't isolate. Your mind can play such tricks on you, especially when you're in a bad situation. Got to stay in touch. You have to be connected to people.
You really do.
I
think I've told you before, I used to work in an emergency psychiatric hospital, and people would come in with fresh stitches from suicide attempts, right? And they would come in and staff would be talking to them during the intake, during the admission, the techs would be talking to them, all this stuff. And I would see them 2-3 days later, and they'd be like, I feel so much better. My antidepressant's kicking in. And I'd be thinking, wow, this is back when it was 4 to 6 weeks.
Yeah, yeah.
And now, again, they probably were taking some other medications that were shorter acting. But really what it was some of these people had literally cut their phone cords, blacked out their windows, like full on isolation. And you would see them start to feel better really quickly once they started actually talking to people about what was going on.
And one of the issues with the meds, a lot of people, because of side effects, although the meds are really good for you, a lot of people don't take them or stop taking them prematurely because they make them feel weird or different.
Yeah, and that's the thing is if you're working with a psychiatrist, really know that it's more of an art with them. They have to really work with you over time, right? Because they will cut down or change the medicine because side effects are a real thing. I mean, you get people that are getting really serious side effects, but then they don't call their psychiatrist. And it's funny, I see in drug and alcohol, I'm like, man, we would just take anything, right? And then when it comes to changing medicines or something, they're like, I just did it on my own. I just stopped everything at once, and they didn't call their doctor.
I heard a funny story.
Yeah.
I don't know if my daughter told me this. Somebody, I'm not even going to mention the rehab. Somebody who was a long-term, user of opioids and everything else was upset because there was something, an ingredient in the food wasn't right. And that was what it was focusing on after 20 years of drug addiction, Hey, when we mention names on here, it's because people are watching us on Facebook and they're going to Clean and Sober Radio, our page. And Ed Mary Donnelly said he spoke at the bridge. He has spoken there. It's still open. Michael Tomlinson says.
Good.
Kathy Lennon said the address, I guess, is 1100 Adams Avenue in Philadelphia for that. Andrea Duffy, Judge Duffy is watching. Marlene Reese Orens Lerner is watching. Hey, Marlene, what's up? I wanted to mention somebody else who I just saw on here. Brant Norton is watching. Hey, Brant, what's up, buddy?
Hello, Brant.
There's a lot of people on here today, man. They're watching. Edmund Anthony says IV tapping.
Yes, tapping, and he says the 4-7-8 breath technique, and you can go on and you can find different ways of breathing where that would be you're breathing in for 4 seconds, holding it for 7, and breathing out for 8, and it should really calm you down.
I just want to say this about what's going on. You can visit, like you want to watch TV and the news. Don't live there, though. Somebody said that to me, gave me that statement. I forget who it was. They were on this show and said, whatever it was, you can visit it, but don't live there. Don't obsess on what's going on because that's another addiction. There's people that are 24 hours a day watching crap. So don't obsess. There's another world out there.
Yeah, and trauma has been such an issue, right? And I was reading some things on like back in the old days, people would have trauma happen to them, but they wouldn't have this vicarious trauma. The 24-hour day news cycle where they're constantly seeing it. Back then, they might find out about stuff a couple weeks later because they didn't have the internet, they didn't have TV, they didn't have that. But it's so serious now because people are so inundated with what's called vicarious trauma, where you're kind of living the trauma that other people are living. And if you're watching some really bad news story, pay attention to your body, and you'll probably feel your body tense up. You'll probably feel the fight or flight response go a little bit. And to have that happening all the time is not good.
Yeah, absolutely. Hey, look, let's take another break. This will be our last break of the hour. I told you we could make it, Mark.
Yeah, it's going quick.
It's going quick. And we come back, we'll continue. And if you want to bring up another subject, call us, 1-888-728-9941. And we'll be right back.
This is Clean and Sober Radio.
A cancer diagnosis can knock the wind out of you. The Sidney Kimmel Cancer Center at Abington Jefferson Health can help. Our brand new Asplund Cancer Pavilion brings you 86,000 square feet of cancer-fighting science for truly comprehensive care. Backed by the strength of an NCI-designated cancer center. Call 1-800-JEFF now. The Sidney Kimmel Cancer Center at Abington Jefferson Health. The power to outscience cancer.
Hi, this is Dion, the Wanderer. Listen to Clean and Sober Radio. You might hear something that'll change your life. Yo!
888-728-9941. This is Clean and Sober Radio.
Hey, we're back, Mark.
We're back.
We are back, and we're talking about how the world can affect the news or other things can affect your sobriety and stuff. And Brad just brought up something very interesting. Everybody knows that Sunday is the Super Bowl.
Yes.
Is that what you call it?
Yes.
And it's Philadelphia, where we are right now, and the Kansas City Chiefs.
Yes. Go Philly.
Go Philly. Okay. So here's what we need from our point of view. Be careful about the gambling. You know, really be careful. And if your team doesn't win, it ain't the end of the world by any means.
Yeah, there's people putting, well, everybody knows this, big money. And the problem with these gambling apps is they're so accessible and so easy to use. And you're seeing, there's definitely this big uptick, right, with gambling. And the thing about gambling is people minimize it, but, it can, I mean, I don't even want to say, but it can lead to suicide.
Oh, sure.
You know, I mean, you hear these stories. And also with drugs and alcohol, I had a friend one time that relapsed after 17 years clean, and he started gambling, and it got so out of control. He hit the point where he was like, well, I might as well just be using because he was so miserable from losing so much money and everything like that. So
yeah,
we got to be really careful.
We got to be real careful. And don't, people get crazy with this. This is not, hopefully it's not life or death, although somebody did die in Philly last week.
Yeah.
Okay.
Yeah.
Not because of the game, but can't blame the game on it. But you get too involved in this stuff. It's a game, is what it is, and don't make it something that it isn't.
And for especially those in early recovery, I've been talking to people where it's their first Super Bowl sober. Right. And that's a whole nother challenge for people is getting used to watching, a Super Bowl and, finding people in recovery that they can watch it with. And it's not all about drinking and everything.
Yeah.
So if anybody's out there that, is struggling with that, know that you're not alone. Right. And when you're at your meeting this weekend, talk to people about what they're doing for the Super Bowl. But yeah, people are taking it. Well, especially since we live in Philly. Right. People are taking this like the end of the world, basically, don't you think?
Yeah,
I mean,
exactly.
Yeah,
it's out of control, man.
It's out of control. I was bummed after the last Super Bowl that the Eagles lost in from a bad call. By the way, I still think about it, and I remember for like 2 weeks I was really bummed out after the last Super Bowl that when the Eagles lost versus Kansas City. I don't think you were tuned in to that game, Gary, but
I must have missed it.
Ah,
I missed that game,
Yeah, bad call. Bad call by the refs.
Jeez, that's a real...
I mean,
What'd you say, Brad? Brad, yeah, what do you want to say,
I don't know,
Brad?
is your mic on? I think they have to turn it on.
Is his mic on? Yeah, you're on.
No, the gambling thing, I don't know a lot about it, but, I mean, from what I remember about gambling is like there's a point spread and you bet but you see the ads for the phone gambling, and it's like it's like you're playing, what's the fantasy football with the performance of individual players.
Yes.
To bet. And it's play by play.
Yes.
That if that could become very addictive, especially if you're down a little bit and you think you could, So I don't, like I said, I don't know a lot about it, but it seems to me like it's a trap that could really be a deep hole to get into.
Oh, yeah.
I mean, you can literally, they do parlays where if this player scores a touchdown, this one, and this one scores a touchdown, you win triple the money. I mean, there's all what you're talking about.
Is that fairly new? I mean, maybe in that world there were a lot of things going on, but to have it in the palm of your hand, not even have to go to a sports book to do it,
it
just seems incredibly dangerous.
Yeah, it does. I mean, I've just noticed it the last couple of years, the last probably 5 or 6 years, but I don't know. Maybe somebody could check how long they've been around, these apps, these gambling apps. But
Well, there's somebody watching us right now that can give us the information.
Yes.
Steve Sussman from Palm
he
Beach,
is.
Florida, and he could give us whatever we're looking for.
Steve,
Yes, Steve.
how long have sports gambling apps, the big ones, been around? And, it's funny because you say like 5-6 years and time goes so fast. It could be like 20. I have no idea. But Steven is one of our best, if not our best, fact checker out there. And he is in Palm Beach, Florida, down there. And I'm sure he's on the beach.
And I'll tell you something. I'll bet he's rooting for the Eagles.
Yeah, and he doesn't really go to the beach a ton, I think. I remember. But, but
he's too busy
he
answering
is.
our questions.
Yes, he's on there. You can look it up. How long have the sports gambling app's been around?
Yeah. And it's really, we're laughing. It's no joke. Gambling is no joke. It ruins families, just like a drug addiction. You might not crash your car because you're gambling like you would if you had some drugs in you, but it's still, it ruins your life.
And there is GA, Gamblers Anonymous, and definitely you can find out about that online, about those meetings, and go out if you think you have a problem. Go to one of those meetings, or actually go see a therapist too. That's another thing, is you get an evaluation, and they'll be able to tell you if it's problematic. Right?
But gambling is more acceptable than drug addiction and alcohol addiction. It's sort of, it's.
Yeah, it's.
What do you say?
Steven, thank you so much. He says the gambling apps have been about 15 years they've been around, and he's going to continue doing some quick research.
Steven, you are our hero, man.
They must just have gotten really popular in the last couple of years. But he's.
I don't think they were legal in Pennsylvania.
Oh, is that what it was?
You think so?
I don't know a lot.
He's doing some. He's doing some research over there.
Hey, Steven, thanks so very, very much, man. You really, you're a big friend to this show, that's for sure. What are you doing this weekend?
So I am tomorrow going to my son's, I think it's his championship hockey game. I think it's the championship. And then going to a fishing flea market in Palmyra, New Jersey on Sunday during the morning. And then I'm going down to watch the Super Bowl down in Brigantine with my aunt.
With your aunt?
Yeah, Gary just rolled. Did you see that? I told my weekend story, and he just rolled his eyes at me.
Don't you think it was weird? He's watching the Super Bowl with his aunt.
With my aunt.
Most guys would say, I'm watching with my buddies. Mark's watching with his aunt. Now, this is nothing about how...
Have you ever hung out with his aunt?
No, I haven't. Yeah, right.
He rolled his eyes. Now, my wife and son will be with me.
Oh, okay. All right.
Oh, wait. I want to ask Gary, what is he doing for the Super Bowl, and if he's rooting for the Eagles?
I will be reading.
See that?
I'll be studying, okay? Just like I never did in school. Anyway, all right, we're coming to the end of the show. And listen, everybody, we had a fun show today, but a lot of very serious and important stuff. If you think you need help, please go to the Substance Abuse and Mental Health Hotline and call them at 1-800-662-HELP, 1-800-662-HELP. And, Mark, you have a very important phone number also.
The suicide hotline, which is 988. Call 988 if you're having suicidal thoughts, and you will get help.
Really important. And
very important.
Hey, listen, we thank everybody for supporting us. I hope you enjoyed the show today. And for Clean and Sober Radio, I'm Gary Hendler.
I'm Mark Sigmund.
What do I say now, Mark?
Have a good weekend, right?
Have a great weekend.
Have a great weekend, everybody.
Go Birds.
Go Eagles.
Who will rain and chase the dust away? Everybody.
I'd like to say thank you on behalf of the group and ourselves. I hope we pass the auditioning.
Hey, thanks, everybody. Really appreciate all the support that you give us.